It's a new day in modern dentistry. You can feel like yourself again with Shatkin Mini Dental Implants. Mini dental implants are the safe, fast, and cost-effective solution to many dental issues. Do you suffer with loose dentures? Are you afraid to smile or unable to eat the foods you love because you have missing or broken teeth? Mini dental implants are your affordable solution.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Welcome to Innovations in Health. I'm John DeSciullo. Happy to be here in Bowling Green, Kentucky with my new friend, Dr. Brian Packard from Precision Dental. He's got a great practice, and we're going to find out all about it and the mini dental implant. It's a procedure that's going to change your life. The mini dental implant is 5 times less, friends. It's less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. It's an affordable product, FDA approved, made in America. And you know what you're going to be able to do if you have dentures? You're going to be able to enjoy the food once again that you love here in South Central Kentucky. Dr. Packard, this is a great life-changing experience, and the difference between a conventional and a mini dental implant is really significant. Show us the difference using that mandible.
So on this mandible here, there's 2 different sized holes. One is a bit larger here that you can see for a conventional implant. The other is much smaller for a mini dental implant. The difference in size, it means that you require less bone compared to the conventional implant. So a lot of patients that don't have adequate bone for a conventional implant could actually be good candidates for a mini dental implant. It also means that a lot of times you don't have to go through procedures like a bone graft or extra healing time. So it being less invasive and less healing time and less expensive is something that obviously our patients have really liked.
Look at that,
Yeah.
The conventional is so much bigger and the mini is so much smaller. And the titanium post, we're going to learn more about it. And we're going to meet more of Dr. Packard's team right after we hear from some people whose lives have been changed with the mini dental implant.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
I'm able to talk and speak with confidence again.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
When I go to the VA, I can give them a big old smile.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
It brought a lot of confidence back to me.
It's just amazing what it does for your self-confidence and how you feel about yourself.
After the procedure, wow. Yeah, you smile.
I am very happy I had the procedure done. I feel as though I have my smile back.
It kind of gave me my life back.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
You're watching Innovations in Health. I'm John DeSciullo, and now we're welcoming Dr. Keith Quinn, who is part of the practice with Dr. Packard at Precision Dental. We welcome Dr. Quinn to the program. Gentlemen, I know that you have a very unique connection because you have both served our country. Dr. Quinn, let's talk a little bit about your connection to Dr. Packard and how you guys came to know each other while you were serving our country.
So my first year out of dental school, I was stationed at Fort Stewart in Savannah, Georgia. Dr. Brian was already there, and he welcomed me with open arms and was a really good mentor when I first got there, and ever since. We became really good friends our time there, and just we connected on so many different levels, both of us being born in California, and just our vision and how we practice and the type of people we want to be, and so we just became really close.
So Dr. Brian, Dr. Keith answered the call. What was it like? You called him on the phone and said, hey, we're starting this practice in Bowling Green and I want you to join us.
Oh, it was great, to reconnect with my battle buddy and be able to reminisce a little bit about some of the memories of working out together during lunches and doing squats.
You still work out together.
Yeah, right. It was really neat. The last year I was in the Army, had the opportunity to really connect with him, like he said, on a more meaningful way and build this friendship. And now it's blossomed even more that he's joined my practice here at Precision Dental. I'm so grateful.
So, Dr. Keith, let's take a look at the lower denture, because if you have a lower denture and it's swimming around on the bottom of your gums, you don't need to give up. You can now get a mini dental implant. And tell us why the lower denture example is so incredible with the stabilization.
Yeah, I would love to. And this is the whole reason why I really got involved with placing mini dental implants, is because of this, what we can provide for our patients. Oftentimes, most patients that have a lower denture will not wear it. And so oftentimes they're just wearing their upper denture because it fits well, the lower denture. They will try the glue for the first couple years, but they find out that it doesn't work, or the glue goes in their stomach, and so it kind of gives them stomach issues, and so they don't wear it, they don't like it. And I never liked treatment planning because I knew that they didn't like it. And so I love that I can offer this for my patients because it is life-changing for them. It is life-changing for you guys. Essentially what we do is we place 4 mini dental implants, 4 titanium posts that go right through the gum tissue into the bone, and it's essentially stabilized, not very invasive, and then we place little clasps inside the denture, and then we can snap the denture right in place, and it's very stable. So patients can eat right away, they can bite into an apple, they can eat whatever they want, and they feel like they got a piece of their life back. So it's very rewarding.
They are confident in their chewing, they're enjoying all the foods that we love. And speaking of the foods, Dr. Brian Packard,
yes,
the palate is exposed on the upper denture. Show us with that example, because as we talked about earlier, the foods that we love here in South Central Kentucky, and the mini dental implant with the upper example stabilizes the denture as well.
On the upper, you'll see that we actually place 6 mini dental implants. The bone's a little bit different on the top versus the bottom. And the denture, actually, we have a U-shaped or horseshoe-shaped to where the palate is now exposed. So this is usually covered up with a conventional denture. And patients have a tough time tasting, enjoying their food. And with it exposed, they can taste better. They can, a lot of times, speak better. We have a lot of patients that have a bad gag reflex, and with this area exposed, it allows them to not worry about that anymore. And again, you take it and you place it right over the top of those minis and snaps right into place.
So there you go. There's the upper denture example. And it's stabilized. And like you said, your speech might be impaired. All of these things are why the mini dental implant is such a leader in innovation and technology. So Dr. Keith, I know that you have a story of a denture patient that you worked with whose life was changed. Share that story.
Yeah, I'd love to. It was, remember like it was yesterday. Her name is Miss Deborah, and she came to me, felt like her life has kind of just passed her by. She doesn't feel like she has her smile back. You can just look at her and her confidence was gone. And she didn't know what she can do about it. She didn't know if there was any options for her. And so we kind of treatment planned to stabilize her in dentures. And as soon as we did that, we took her teeth out, delivered the denture the same day. You can see, as soon as we did that, she got a piece of herself back. She can smile again. You can see that joy in her. Her smile was authentic. And it was so empowering. And so it's something that really inspires me to do what I do. And it just makes everything wonderful. And so just provide these types of things for our patients, it's just amazing.
It is amazing. And Dr. Brian Packard, you have the ability to do this in office, right? So whatever dental location you have at Precision Dental, you're doing the mini dental implants right there on Nashville Road or in Fairview Avenue. It's an in-office procedure.
That's right. We can provide this for our patients right there in our office and very comfortably. We offer different forms of sedation dentistry, whether it's oral sedation or nitrous gas, so that they're nice and comfortable and have as good of an experience as they can while having the mini dental procedure.
Dr. Keith, if somebody's told that they can't get an implant, that may not be the case, right? If somebody has a particular bone density, the mini dental implant will work with that titanium post.
Oftentimes you have to have the right amount of thickness, the right type of bone to place conventional implants. And so a lot of patients are going through life thinking that that's not an option for them anymore. Well, now we have this option where they don't need a lot of dense bone or thick bone. And so a lot of times we can treatment plan, take a 3D scan, and oftentimes we can place these mini dental implants where conventional implants don't work.
And Dr. Brian Packard, this is a practically pain-free experience. Tell the viewers why.
We make sure that everything is comfortable with a form of sedation, but we also use anesthetics so that the patient doesn't feel anything, and it's a very quick, easy procedure. Patients all the time, we're done and they'll look at me and they'll say, "Is that it?" And I'll say, "Yeah, that's it, we're done."
And what do you prescribe after somebody's mini dental implant?
We prescribe an antibiotic like an amoxicillin or a Z-Pak, something really simple just for infection prevention, along with some ibuprofen or Motrin. And I will prescribe a narcotic just in case they may need it. However, most of my patients maybe take the ibuprofen once or twice, and that was it.
So Dr. Packard, the affordability of the mini dental implant or any dental procedure that you offer at Precision Dental is something that you work with the patient to make it affordable.
Precision Dental, we have wonderful treatment plan coordinators that work with our patients based on their budget, and we have different financing options, whether it's with Care Credit or Sunbit or Cherry, in order for our patients to be able to afford and make payments for the treatment so that they can get the smile that they want and deserve now. And it's been a wonderful thing for our patients to take advantage of and to be able to get their smile back, confidence back now, and us be able to deliver the treatment while also them being able to finance it over time.
Dr. Packard, you made some great connections with Dr. Keith, and there's another member of your dental practice, another battle buddy, who's there sharing this experience to help patients. Tell us about that.
Yeah, another battle buddy of ours, Dr. Nazanin Ghazi Sharif. Everyone knows her as Dr. Naz. She's been a wonderful doctor and partner of ours at Precision Dental for many years now. There's 3 battle buddies. Serving my country has been the gift that continues to keep giving with these 2 wonderful individuals having joined our practice and serving our patients now as we once served our soldiers at one point in time in such a magnificent way.
It's a terrific story and a terrific experience, and it's only at Precision Dental, and there are 2 locations. The first is at 2625 Nashville Road, Suite 103. It's right near I-65, you can't miss it. And of course, next to Precision Eye Care. The phone number to call is 270-715-9214. And the other location is at 1042 Fairview Avenue, Suite C, near I-65 as well. And that's close to the Med Center. We all know where that is. Here in Bowling Green, Kentucky, the phone number is 270-746-5880, and the website for both locations is precisiondentalbowlinggreen.com. Now, we're going to find out more about your practice and more about how you can become confident with the mini dental implant. Take a look at these patients.
I had a lot of difficulty in eating.
But with these, I can eat everything.
It was done, over, done. Go home and eat.
I can eat steak, I can eat sandwiches.
I had dinner 45 minutes later.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
This is something that is so incredible.
It's made a tremendous difference.
If you're missing teeth, I would just recommend it highly. I'd get as many as you could.
I'm very, very pleased that I have them now.
You're watching Innovations in Health right here in Bowling Green, Kentucky with our friends from Precision Dental, and I am honored to welcome Dr. Forrest Packard. Not only is he a member of the group there at Precision Dental, he's the dad of Brian, and we are now going to find out what it's like, father and son, son and dad, to work together. We'll start with you, Dad. What is it like to work with Brian?
That's a great question. You know, I think every parent that is raising their children hopes that they will grow up to be good, responsible citizens and even exceed what their parents do. I have never tried to force my children or encourage them to go any specific direction in their lives as far as their careers, but when Brian decided to go into dentistry, I was very happy, to say the least, and I supported him 100%. And I can honestly say now that Brian has exceeded my expectations, and it's a dream come true for a parent.
Brian, how does that make you feel, not only to hear that from your dad right here on TV, but to also work with your dad?
Yeah, feels, thank you, Dad. It's a dream come true from, you know, when I was a little boy, I always looked up to my dad as my hero. And to be able to work with him is an honor and a privilege of mine. And obviously growing up, wanting to be just like my dad, just like him, it's just so wonderful to see him now side by side in my practice and get to enjoy it in a way that I know I probably hoped for when I was a little boy.
You're helping everybody here. You're innovators in health here in Bowling Green, Kentucky. And let's talk, to go back to the mini dental implants, let's talk about what's called the fixed on 6. If God gave us our baby teeth and adult teeth, Dr. Packard, you're going to give us our third set with the fixed on 6.
This is actually my favorite treatment with the mini dental implants. I love it so much. My patients love it so much. We place anywhere between 6 to 8 implants for this amazing restoration to go over the top of it. As you can see, it's like getting brand new teeth back. They're beautiful. They go right on top of the implants, and they're very secure. They only come out when the patient comes back for their 6-month maintenance visits, and I remove it for them, and we make sure that everything's nice and cleaned up and switched out underneath so that I can put it back on for another 6 months, and the patients love that. And as you can see, just beautiful, beautiful teeth. It gives the patients an extraordinary amount of confidence and self-worth back and value, and they just don't hesitate anymore, smiling ear to ear. I had a wonderful patient who coined this term and phrase for us called smile anxiety. And if you go long enough with smile anxiety, trying to hide your smile, when you get it back, what that means to you as a person and the confidence and how you can live your life again in a way that I'm sure you always hoped you could, that has been very fulfilling. It's something that I absolutely love doing for my patients. And when they come in for their maintenance visits, it's one of my favorite visits because I get to see that confidence. I get to feel that energy, and I'm so proud of it, and I'm so grateful that me and my team get to do this for our patients here in Bowling Green.
And that's a porcelain product. It's made to take a licking and keep on ticking. Your dad will remember where that's from. And speaking of which, how long have you been in practice, Forrest?
About 40 years.
40 years, so you've seen technology change, the mini dental implant being a part of that technology, but there's also something that you offer at Precision Dental called the cone beam. What is the cone beam?
Cone beam, it's basically a 3-dimensional image of the jaw. And what that does is it allows us to go in and actually measure the amount of bone height that we have, the thickness of the bone. It shows us where the nerves are. It shows us where the sinuses are, so that we can determine the best size, diameter, and length of implant that is needed to be able to give the best product we possibly can to our patients.
You have another example of a mini dental implant. If somebody loses a tooth in the front, the single tooth option is something the mini dental implant will fix. Dr. Forrest Packard, tell us why.
That's great. Not everybody plans on losing their front teeth. Either the tooth cracks or it gets knocked out. Either way, when they lose a front tooth, that's quite traumatic for most patients. That's for sure when they're not going to smile. And they don't like to show people that they're missing a front tooth. So what we can do is we can go in and we can put an implant right there in that front spot, and we can make for them a tooth, a crown, that fits right over that, and it replaces it so that it looks just like it did before. This is designed to look just like the tooth that they lost.
And if you have teeth that are in the back, those back teeth are the workhorse teeth. They chew the food, they get all the nutrients out. Show us the mini dental implant example of how to fix that problem.
When we lose our back teeth, there are a lot of things that can happen. And one of the things is that we lose the ability to chew on that side, and so they begin to compensate by chewing predominantly on the other side, which can cause joint problems. It can cause eating problems. And so what we do is we put implants in the number that we need to be able to replace those teeth, and then we can put in either a single tooth or we can put in a bridge to replace those teeth to get them back to normal function.
Now tell us about your families, and I know, Dr. Bryan, you have some children, and Forrest, you're one of 12 children, I understand. Right?
I am one of 14.
14, my gosh.
Children,
yeah.
And Bryan is one of 12. My father was a dentist. I followed in his footsteps, so Bryan is actually the 3rd-generation dentist in our family.
You don't have 12 children, do you, Bryan?
I don't. I have 4.
Okay.
So I think my wife is very happy. I'm very happy with our 4 children. We love them dearly, and we have a wonderful time together. And yes, dentistry has, it's been such a wonderful thing for my childhood and growing up, having my father be a dentist, and also now getting to also hopefully follow in his footsteps and be a good example to my children as well, and being present and being hopefully the father that I know I want to be for them.
And I know that not only do you practice dentistry together, you go and fish. And tell us about some of these fishing experiences, because it's not just fishing like in Bowling Green, it's fishing in big time.
It's from a young age. I was introduced to it by my dad, and I tried to take Brian and his other brothers on camping trips, backpacking trips, fishing trips, and it's given us an opportunity to bond, and we do enjoy fishing, yes.
Yeah. And I know that you both travel up to Buffalo, New York, and you meet Dr. Todd Shatkin. So you
Correct.
get the innovation in health with the mini dental implant technology, and you bring it back. Explain that connection, Brian.
Yeah, it's been wonderful because over the last several years since I started placing mini dental implants, I've had the opportunity to go up to Buffalo 4 or 5 times now, and it's always been such a wonderful thing to learn more about and be educated on the innovations in dentistry, the things that are more cutting edge, that are benefiting and blessing our patients' lives, and how we can incorporate that into precision dental to bless our patients' lives.
And you've changed a lot of lives. And Dr. Forrest, you've probably treated tens of thousands of patients, maybe hundreds of thousands. But share a story about how the mini dental implant has changed a life.
Yeah, I had a patient when I was practicing in Washington State. It was a middle-aged woman, Kathy, and she had lost most of her posterior teeth, the big chewing teeth that we were talking about. And she, as a result of that, her teeth began to separate. She smiled less. She didn't want to show her smile. And so after sitting down and consulting with her, we decided to remove all the remaining teeth that she had. We placed implants on both the top and the bottom, and then gave her some dentures. And once those dentures were attached to the implants, we were able to remove the roof of the palate, or the roof of the material that was on the roof of her mouth. And so it was like giving her teeth back, and she smiled more. She was a completely different person, for sure.
It's amazing what you've done. And all of that happens at Precision Dental's 2 locations in Bowling Green, 2625 Nashville Road, Suite 103, near the I-65, and next to Precision Eye Care. The phone number is 270-715-9214. Their second location is at 1042 Fairview Avenue, Suite C, near the I-65, close to the Med Center. The phone number is 270-746-5880. And the website for both locations is precisiondentalbowlinggreen.com. So Dr. Brian, this family affair continues because Precision Eye Care and Precision Dental have a unique relationship. Explain that.
They do. I get asked all the time, well, how does a California boy end up in Kentucky? And it's because I married a beautiful, wonderful Southern belle here in Kentucky from Muhlenberg County, about an hour away from Bowling Green here. And her uncle, Dr. Robert Duvall at Precision Eye Care, is 9 years ago now. We were at his Thanksgiving table, just finished up eating, and he brought out this blueprint of this new state-of-the-art optometry clinic that he was building off of Nashville Road. And right next to it, there was a space there. And I asked him what he was thinking about putting in that space. And he said something probably healthcare related, like pharmacy or physical therapy. And I remember asking him if he thought about putting a dental office there before. And he looked up at me and he said, I'm thinking about it now. And the rest is history. We talked almost every day for months after that, just thinking about what things could be and this vision of this beautiful new optometry clinic, this beautiful new dental clinic. And that's where the whole dream started. And I couldn't be more grateful to Robert, Dr. Duvall, and his family, and to have just lucked out to have married their wonderful niece.
And your wife is a dental hygienist as well.
She is.
Not in practice now because she's got the family to worry about.
Right, right. We started Precision Dental from scratch, working in room 1 and 2 next to each other. Her is the hygienist, me as the dentist, and there was a lot of sacrifice that was made, and I'm so grateful to her in every way possible. She means the world to me, obviously, and Precision Dental wouldn't exist without her, and I'm so incredibly grateful to her for everything that she has done on the behalf of this dream.
Forrest, Brian, you make a great father and son and dad team. Thank you for joining us here at Innovations in Health, Forrest.
Thank you, John.
Stay with us because we're going to find out more from what Dr. Brian Packard does at Precision Dental right after we hear from some of these patients who've had a great pain-free experience.
It was totally painless.
What pain?
I had no pain.
I didn't have any pain. It didn't hurt.
I never felt a thing.
There was no pain, no discomfort whatsoever.
One trip, it's great.
One visit, you're done.
Less trips, the better.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
It was good.
Welcome back to Innovations in Health. I'm John DeSciullo with Dr. Brian Packard from Precision Dental. And the mini dental implant, we've been learning about it for the last half hour. The mini dental implant is 5 times less invasive, less discomfort, less healing time, less visits to the dentist, less expensive, and affordable solution for all of us here in South Central Kentucky. And before we go, Dr. Brian Packard, I know that from Precision Dental here in Bowling Green, you are giving back to the community. And it's an incredible story with a great personal connection. And I want you to share that with the viewers.
Absolutely. It's been 7, almost 8 years now since my wife and I started from scratch Precision Dental. And when we were putting together our vision for Precision Dental, what it would look like, what it would feel like, what it would smell like, and we wanted there to be a connection to our community here in Bowling Green, something that meant more than dentistry, more than fillings and crowns, something that our children could be proud of. And as my wife and I were talking about things that are a little more meaningful to us, my baby sister, Emily, came to mind, and she was born with special needs and passed away when she was very young. And in our family, she's known as our littlest angel. And we wanted to maybe find a way how her legacy could live on and be something more. And we got introduced to Laura Orslin, the founder and CEO of The Hive, which is a nonprofit organization here in Bowling Green, Kentucky, for adults with intellectual and developmental disorders. And if my baby sister were still alive today, she'd be able to participate in this wonderful organization and this wonderful group of people. And so we got to talking with her, and we founded 20 for 20 here at Precision Dental. And for every 20 new patients that we see at Precision Dental, we sponsor the $20 tuition, monthly tuition for a Hive member. And it's been a wonderful way for us to have a deeper, more meaningful connection with our community here in Bowling Green, with the wonderful people there at the Hive. And our whole team gets to enjoy it, our patients get to enjoy it. And it's something that is obviously deeply meaningful to me and my family. And I'm just so grateful that we get to do that here in Bowling Green.
And if you'd like to help support this great organization, you can go to their website, thehivebg.org. Well, Dr. Brian Packard, you and your team at Precision Dental, we should remind everybody of your 2 locations at 2625 Nashville Road, Suite 103. It's near I-65, right next to Precision Eye Care. The number is 270-715-9214. And the other location, 1042 Fairview Avenue, Suite C, near I-65 as well, and that's close to the Med Center. The phone number to call is 270-746-5880 and online at precisiondentalbowlinggreen.com. It's been an honor to meet you, and good luck to you here in Bowling Green, Kentucky.
Thank you so much, John.
Thank you for joining us, and thank you for watching.